Welcome back. The new year has begun, meaning it's a good time to get your health goals on track, especially for all you seniors out there. Right now, it's a great time to schedule a comprehensive annual visit, and P3 Medical Group is a great place to start. Joining us now with a little more is Dr. Tracy Wakefield, president of P3 Nevada Medical Group, along with primary care provider Dr. Haley Kuhn. Ladies, welcome to the show.
Thank you. Great to be here.
Yeah, it's great to have you. I think this is a terrific topic because so many of us wait until we're sick. For instance, we spoke about how many people have the flu right now this time of year to go to the doctor, when in fact, if you go ahead and schedule that comprehensive visit, you can almost get ahead of the ball, can't you?
Absolutely. Great time after the New Year's. You've made your New Year's resolution. So now it's time to kind of make that checklist of doing the things you should be getting done this year. One is scheduling this comprehensive visit or annual visit with your primary care provider, where you can make sure you've had your immunizations, get up to date on all the information, and just make sure you're covering everything you need to do this year to keep yourself well.
Yeah, absolutely. Can we touch on those immunizations?
Absolutely.
Let's talk, especially for seniors, right? There are some that are quite recommended.
Correct. There's particularly now. You remember it's the flu season. Make sure you've gotten your flu vaccine. Not too late if you haven't gotten it yet. Also, pneumonia shots are very common that seniors need to keep themselves well. Remember, too many people pass away from something as preventable as pneumonia and flu. So not being vaccinated is really just not an option.
Okay. After what age do you recommend that seniors always get a flu shot?
Everyone should get a flu shot.
Everyone?
Okay, everyone over, yes.
All right.
So yeah, I think that includes most of us, is everyone. so yeah, everyone should get a flu shot, but the pneumonia shot is particularly important as we get older and become seniors or have other conditions like lung disease and kidney disease. Those people may need pneumonia shots earlier.
Okay, great. Let's dive a little deeper into this comprehensive visit for seniors. What are some other things that will be covered in that visit that are important?
So usually when patients are coming in for their comprehensive visit, we're trying to establish their baseline health. And so in doing so, you'll have the standard measures, so blood pressure measurements, weight measurements, and things like that. We'll also do vision and hearing screening testing. Sometimes we'll order other screening tests that are appropriate for the patient. Make sure that their mental health is okay, that there's no concerns there. Make sure that they're feeling safe at home and that there's no issues with safety. And then also, again, just touching up on immunizations, making sure that they're up to date on all of their recommended immunizations.
Yeah, I think we used to refer to this visit almost as your yearly physical, didn't we?
Well, yeah, in a sense, absolutely. Not just the physical exam, like Dr. Kuhn mentioned, but it's also checking on, like she said, safety issues. Is your home safe for you? Your vision, your hearing, are those really optimized so that you can be aware of your surroundings? But also the immunizations, all the other stuff. So not only the physical, but it's also so much more involved, and also kind of talking to you about your loved one. Who do you want to make decisions for you when you're not able to make decisions? So it's a really good start to, like I said, kind of just get ready for the year, make sure you've got all those boxes checked, and be prepared.
Certainly. I see why you use the word comprehensive now.
Yes, it's comprehensive.
No, let's talk about everything. That's great. And for some people with pre-existing conditions or more serious health conditions, these visits are also very important. Let's say someone is diabetic. How would that change their comprehensive visit?
So there are things that diabetics need to have during the year. They need their eye checked. They need to be screened for kidney disease. So it's just one of those other things where not only do they have the common things that other seniors have, but there are things specific to their diseases that need to be maintained and evaluated throughout the year.
For sure. Did you have something to say as well,
so our
Dr.
seniors, so our seniors with chronic conditions, a lot of times at their visits, we're really addressing those chronic conditions. And like Dr. Wakefield said, some of those things that go with it. When we get to see them for this wellness visit, we really get to understand their overall wellness, as well as hit on some of the preventative care measures that maybe we don't address at those chronic condition visits. So they're really important.
Definitely, absolutely. We want to encourage everybody to schedule those now. Again, before you are not feeling well.
Absolutely.
And then you're waiting to get that appointment. Not a lot of waiting though at the P3 health centers, which is really incredible. You have now how many P3 centers around Las Vegas.
So tomorrow we have our 9th grand opening of our 9th clinic. So it's very exciting. And like you said, you know, we don't want seniors especially to wait, because there's nothing worse than you've got a little bit of illness, you can't get into your provider, it escalates and is a worse condition, and you end up in the emergency room. So for us, it's really expanding the care to seniors in this valley and allowing them to get care when they need it.
And some of your clinics are a little more senior focused, aren't they?
Yes, they are generally very senior focused, and we have a lot of clinicians who are really experts at taking care of seniors. So we encourage seniors, especially if they're having trouble getting into their healthcare providers at this time of the year, think about where you're getting your healthcare. Are they seeing me when I'm sick? Are they getting me in when I need it? So think about that as we go into this year.
Yeah, short wait times is a very important thing to address.
Absolutely.
Especially here in Las Vegas, isn't it? My goodness. So if people stop by this open house tomorrow, not only will they get to see the facility, they'll get to understand a little bit more about what you do and meet some doctors.
Absolutely. They can meet, mingle with the providers, get to know the location, and really kind of understand how we approach wellness, not only just treating you when you're sick.
Great. Ladies, thank you so much.
Thank you.
All right. Again, tomorrow, stop by the grand opening of P3 Medical Group Desert Springs Clinic. It is from 9 a.m. till 11. In the meantime, you can learn more about their services by visiting the website or calling the number right there on your screen. This morning, we featured the brand new location that officially opens tomorrow. P3 Medical Group is a proud sponsor of the Morning Blend.